Hello, good morning to everyone. Today we are going to deal the topic that is the diaphragm. So as per your request and we are going to once again to cover the topic that is the diaphragm. So when you see the all muscles of the body and when you see the diaphragm, so this is also one of the chief muscle of respiration. So this is a partition where situated in the thorax, separating the thorax and abdomen. So when you see this slide, in this you can see the thoracic cage or thorax, and below this we are going to have the abdomen. So that you should know the first one, what is the diaphragm. So this is a muscle I have told. It is one of the chief muscle of respiration, so that it is a dome-shaped muscle forming the partition between the thorax and abdominal cavity. So here, one thing you have to remember, the muscle means it has the origin, insertion, nerve supply and actions. So you have to know the first one. Almost all the muscles which are there, they are, you have to remember as it is one of the having the muscle origin, insertion and nerve supply, action and clinical anatomy. So this is a must you have to remember in the diaphragm. So my dear students, first one you have to remember the introduction, that is the diaphragm is the chief muscle of quiet respiration, separates the thorax and abdominal cavities. It gives the many passages to the number of structures passing in both the directions. Means what? Towards the entering towards the thorax or going to the abdomen. So this is the one which is a partition which you should know, that is the structure which are entering from the thorax to the abdomen and abdomen to the thorax. So this is one of the important thing you have to remember in the one in the diaphragm. So first of all, you have to know the diaphragm is a chief muscle of respiration. It separates the thoracic and abdominal cavities. So I have told the many structures which are entering into the thorax are going from the thorax to the abdomen. They are crossed, that is while traveling to the thorax to the abdomen or abdomen to the thorax. So it is very important to remember about the one of the thoracic diaphragm. So we have the pelvic diaphragm that you have to remember different, and this can be asked as a 5 mass in the thorax, that is you have to remember. Next you have to tell about the in the definition, you have to know about the almost all the things which is you have to remember in this is, that is the whatever this muscle which is present, almost all we have the skeletal muscle, cardiac muscle and smooth muscle. So in this you have to remember the that is the one thing you have to know, that is the so after the introduction we are going to deal about the next to the, that is the introduction. After that we are going to deal, just to tell you the brief about the, that is the definition. So diaphragm is a dome-shaped muscle forming the partition between the thorax and abdominal cavities. It is the chief muscle of respiration. So it has the origin, you have to remember. This muscle has the origin points you have to remember. it has the 3 points of origin. So it is originating from the first one. You have to tell about the three parts it is arising origin, that is the sternal part, costal part, and lumbar part. So one thing you should remember here, the diaphragm originates from the sternum bone, then costal part, that is the ribs, then lumbar part, that is the vertebrae, lumbar vertebrae. So these are the three main bones you have to remember for the explanation of the origin of the diaphragm. So here first one you have to remember about the whatever the sternal part arises from the fleshy slip from the back of the gypoid process. When you studied the attachments of the sternum, there you come across the that is the origin of the diaphragm attached to the gypoid process of the sternum. Second one, we have the ribs, costal part, that is almost all arising from the arising lower six ribs on each side at the inner surface. They give origin to the, that is the diaphragm. So inner surface of the cartilages and adjacent part of the lower six ribs on each side, they are that is the uh, attachment of the origin point of the diaphragm, costal part. Then comes about the lumbar part. It is attached to the lumbar vertebrae, that is the medial and lateral lumbocostal arches, lumbocostal arches, and from the lumbar vertebrae by the right and left crura. So this is the one which is you have to remember about the total explanation of the origin of the that is the origin point of the diaphragm. Okay. Next, going to the other lumbar part you have to remember here. So one thing you have to remember, the more detail of this is not required. So just whatever I have told just now, origin sternal, costal and lumbar, and that you have to remember about the almost all the points for the origin. So next one, can you explain the medial lumbocostal arch, lateral lumbocostal arch, that you have to remember, and right crush, and we have the left. So this is all about the, once again to revise, you have to know that is the almost all the origin, as the diaphragm is one of the muscular muscle which is a partition, dome shaped muscle forming the partition between the thorax and abdominal cavities, and chief muscle of respiration. Then going to the origin, you have to remember origin, the fibers may be grouped into the three parts. They may be arising from the sternal part, sternal fibers, costal part, costal fibers, and lumbar, lumbar vertebrae, lumbar. That you have to remember. Then they are arising from the gypoid process of the sternum, costal part, lower sixth part, inner surface of the cartilage, and lumbar part arises from the lateral lumbocostal arch and from the lumbar vertebrae by the right and left crura. So this is one which is you have to know about the in that. Then medial lumbocostal arch, lateral lumbocostal arch, you have to remember right crush and left crush. That is all about the, you have to remember about the origin. When you see the diaphragm, as it is one which is arising dome shaped, which is arising, attaching from the anterior aspect sternum, and here on the both the side laterally, which is arising from the both the side right and left, that is the ribs, and posteriorly we are going to have the, that is this is a part which is attached to the, that is the lumbar vertebrae. So this is one you have to remember in the, that is in the origin point of the diaphragm. Next, going to the insertion, when you see this is a muscle, as your superior view of the diagram, you can remember this is the anterior part and this is the posterior part, which you can remember. And in this, you can see the almost all the fibers from the anterior and lateral and posterior, they come and attached to the making the central tendon, and that is the insertion point of the diaphragm. So diaphragm is inserting at the central tendon of, that is formed by all the fibers which are coming from the sternum, costal and lumbar vertebrae, and they are attached to the totally in the central tendon, which is, it is above this, the pericardium and heart is situated on the central tendon of the diaphragm. So that you have to remember about in the insertion. So this central tendon of the diaphragm lies below the pericardium and it is fused to the later. The tendon is trilobar, means it appears like three lobes, like you can appear. So this one is a 2 and 3. So it is appears like a trilobes structure or in the shape, made up of three leaflets. We are going to have the middle leaflets. This is the middle leaflets, and we have the right and left. So whatever when you see the this is called in the middle leaflets is a triangular in shape with its apex directed towards the gypoid process. This is here you have the gypoid process attachment origin fibers. Then right and left leaflets. This is one right leaflets and this is a left leaflets, and these are, they are the tongue shaped and curve laterally and backwards. They are curved and that is going to the laterally and backwards. So these are the, you have to remember about the three points trilobar in shape, that is a central tendon, because all the fibers of the diaphragm, they are inserting at the central tendon. Insertion of diaphragm is what? That is this, they are all the fibers from the anterior, that is sternal, lateral from the ribs, costal, then posterior, that is from the vertebrae, lumbar vertebrae. These all three fibers of the origin point, they come in a central part of the diaphragm, making the central tendon. So I'm talking about the, which is making a one which is anterior. Then we have a right and left leaflets. So this is the point you have to remember. Right and left trilobar, I have told, right and left we have the tongue shape, and that is you have to remember. That is about the remember about. So Sakshi, don't write anything on the screen. I can see the your anything if you make on the screen. I see properly your name and everything detail. So concentrate that you should not touch the screen, but because it may cause the some lines on this. So that don't touch the screens much. So this is all about the insertion of the that is the diaphragm. So I can see everything about when you touch the screen. I can see your name and everything. So that be cautious. That is, don't understand that is anything you can do. We cannot see here with name and everything. I may disconnect from the lecture if you do so. So remember that is I can throw you from the lecture. So just you have to remember about the insertion point I have told. Next point after this is most important question which is asked about the, that is the, what are the openings of the diaphragm? This is the one student who is asked me, who is a boy's name, who asked me to take this diaphragm. Anyone he joined? Unmute yourself.
Sir,
What is your name?
Sripat sir,
Huh?
Sripat Gangul.
Gangul. Okay. See, are you understanding following points?
Yes sir.
Properly you can see the diagram and everything.
Yes sir, seen sir.
Gangul, na?
Yes sir, Sripat Gangul.
Sripad. Okay. Because of that, you have given me a topic. I have again, and henceforth, everyone should take that. This is all revision. So, any difficulties you have to send me the topics. Don't keep on discussing what is all rubbish things which you are going on discussing, and everything importance you don't understand, which is the weightage is there, and which we have to study. and the CNS almost all topics are covered, and only that is like option 3 questions you have to make. I have told about minimum 8 questions of CNS that you have to remember. And most important question which is commonly asked in the exam is that is the what are the openings in the diaphragm. I have first only in the introduction I have told structures which are entering from the thorax to the abdomen and coming from the abdomen to the thorax, they are crossing the diaphragm. So we can make the, here you can see the total diaphragm muscle fibers, and this is the insertion points you can see. And in this all muscle, we have the larger openings and smaller opening. Major, we have to remember about the larger openings of the diaphragm. Even in 2 marks question, it can be asked, name the larger openings of the diaphragms. So one first you have to remember that this is a aorta. So we can call this is a thoracic aorta, which is descending thoracic aorta, entering and continues in the abdomen, abdominal aorta. That is the aortic opening we call. Next comes about this is the esophageal opening. I am talking about the larger openings of the diaphragm. Then third one is I am talking about the that is the inferior vena cava. So almost all this is you have to remember esophagus from the cervical part, thoracic part entering into the abdomen. This descending thoracic aorta continues as abdominal aorta down, and inferior vena cava, that is a crossing and opening into the that is the right atrium. So this is a venous return coming from the abdomen to the thorax, opening into the right atrium, and the thorax to the opening into the cardiac orifices of the stomach, that is the esophagus. And descending thoracic aorta, it will continues as a downwards as a that is abdominal aorta. So this is a very important thing you should know about the larger openings of the that is the diaphragm. So with this again we have the small openings. So you can see with the aortic opening we have the azygous vein, thoracic duct, and with the esophageal larger opening we have a left vagus, we have the right vagus, and esophageal branch of left gastric artery and accompanying veins, artery and vein. And with the inferior vena cava, we have the right phrenic nerve. This is the right phrenic nerve. So this is all about the larger and smaller openings of the diaphragm. Other smaller opening you can remember, that is one which is you can remember about the openings. In that you can remember about the totally almost all the things which are I have told just now. You can see highlight here. Aortic opening at the level of the 12 thoracic vertebrae, that is very important level, and esophageal 10 thoracic vertebrae level you have to remember. Then you are going to remember inferior vena cava, that is the 8th thoracic. Means what? 8, you have 10th, and we are going to get 12. So reverse way you can remember, that is very important. So this is all about the total, about the larger opening. Other few small openings you can see in the diaphragm, that is the crush of the diaphragm. It pierced by the greater and lesser splanchnic nerve. And left crush is pierced by, in addition to the hemiazygous vein. You know the azygous, accessory hemiazygous. So hemiazygous left crush is pierced by the, that is a hemiazygous vein. Next comes about the other parts which are crossed. They are the, you have to remember about the most important, they are the small structure which are crossing. So most important you have to remember here, esophageal, inferior vena cava, aortic, larger opening, that you have to know. So this is all about the larger and smaller openings of the diaphragm. So next, going to the relations. As you know, it is a partition between the thorax and abdomen. So upper thorax superiorly what are related? Related to the pleura and pericardium. And inferiorly, we have the all abdominal organ, abdomen, peritoneum, liver, fundus of stomach, spleen, kidney, suprarenals, all they are related to the, that is a, means what? These all organs in the relations, we have the diaphragm as a relation. So almost all these organs, we come across diaphragm as a relation. So those all you have to write inferiorly. And superiorly, you have pleura and pericardium, because central tendon of diaphragm is almost all the pericardium and heart is situated. So that is about. This is all about the relations of the diaphragm, that is superiorly and inferiorly. So next comes about the, what is the nerve supply? As it is a muscle, you have studied the introduction, definition, origin, insertion, what are the larger opening, what are the smaller opening, and relations. Now you have to come across the, what is the, that is the nerve supply of the diaphragm. So as it is the other name for the diaphragm is a phrenic. So we have the nerve which is a phrenic nerve, sole motor nerve to the diaphragm, and that is a root value, that is a C3, C4 and C5. So this is you have to remember about, very important, because when you study the shoulder joint, nerve supply, suprascapular nerve, that is also having the C3, C4, C5. So irritation of the diaphragm can cause the shoulder tip pain, because they are arising from the same root. So that you know the any diseases or any irritation of the diaphragm that may cause the, that is the, that is the shoulder tip pain. So why? Because their root value is same, phrenic nerve and supraclavicular nerve. So that is very important point you have to know. That is sometime is a pathology or a disease affecting diaphragm and mimicking, that is the shoulder pain. So you should rule out this one. Is it not having the any disease relating to the diaphragm when person is having the shoulder tip pain? So this is a very important point which is you can remember. And this is all about the motor nerve. Sensory phrenic nerve are sensory to the central part, and lower six thoracic nerve are sensory to the peripheral part of the diaphragm. So central tendon and peripheral part, you have to remember six thoracic nerve, and we have the phrenic nerve. This is all about the nerve supply of the, that is the diaphragm. Then going to the action of the diaphragm. As it is a muscle, it should have the action. So what are the actions of the diaphragm? So my dear students, first you have to remember the principal muscle of inspiration. Means I have told in the definition, it is one of the principal muscle of the respiration. So in the respiration, inspiration plus expiration equal to respiration. So here the main muscle for the, this is for the principal muscle of inspiration, breathing air inside. On contraction, the diaphragm descends, increasing the vertical diameter of the thorax. This is you have to remember in the first action is the diaphragm is principal muscle of inspiration. Then diaphragm acts as an expulsive acts to give additional power to each efforts. Means what? Expulsive act like what? Sneezing, coughing, laughing, crying, vomiting, micturition, defecation, parturition, giving birth to the child, that is a parturition. Deep inspiration takes place. This is followed by closure of the glottis, you know, in the larynx, and powerful contraction of the trunk muscles. So that is the one most important action of the diaphragm is expulsive acts. So expulsive acts like I have told sneezing, coughing, laughing, crying, vomiting, micturition, defecation, or parturition. So these all during this, the diaphragm is one more important action, that is a action. Next comes about the that is a third one, as it is esophagus crosses the diaphragm and it is opens into the cardiac orifices of the stomach. So sometime at the when esophagus is crosses the diaphragm, and it will act like a sphincteric action in the lower end of the esophagus is due to the contraction of the intrinsic muscles in the lower 2 centimeter of the esophagus. So this is very important sphincteric action you have to remember. So most important actions are three. One, you have to remember about the principal muscle of inspiration, then all expulsive acts. Then third one, you have to remember about it is a sphincteric action in the lower end of the esophagus. These are the three actions relating to that is the diaphragm. Then going to the last part of the diaphragm is you have to remember about that is the clinical anatomy. So we have studied almost all the heads, introduction, definition, origin, insertion. Then I have told the openings of the diaphragm, larger, smaller, all you have to remember. Then you have to know about you have to remember about what is the clinical anatomy of that is the diaphragm. So my dear students, first clinical anatomy you have to remember, that is a hiccup. So is the result of the spasmodic contraction of the diaphragm. Spasmodic, suddenly there is a contraction of muscle fibers that may leads into a production that is we call as that is a hiccup. So in Marathi it is called as a uchki. So somebody reminds you means you will get the hiccups or not, that is not there. And this is all which is that is said that any irritation above and below the diaphragm that can cause the hiccup. Usually it is one of the common condition we have, that is a hyperacidity. So that you have to remember in this, that is a hiccups. नाहीतर कोणीतरी आठवण केल्यावर उचकी लागलो असं काही नाही आहे anatomy मध्ये. Okay, so you have to remember about that is any irritation to the diaphragm or above or below that diaphragmatic part that can cause. Then second clinical anatomy is a shoulder tip pain. I have already told in the nerve supply, irritation of the diaphragm may cause the referred pain in the shoulder because the phrenic and supraclavicular nerve have the same root value. So this is very important. I have told C3, C4, C5. That is a 1 second applied anatomy point you have to remember. Next comes about the unilateral paralysis of the diaphragm. When phrenic nerve damaged or when phrenic nerve is injured, then there is a paralysis of that is the diaphragm. So it may be the one side, so that we have the unilateral paralysis of the diaphragm. So that you have to remember. Then sometime we have the eventration, is a condition in which the diaphragm is pushed upwards due to the congenital defect. So during the developmental process, the diaphragm is normally placed between the thorax and abdomen. So during development, or we have that is congenital defects, like that time the diaphragm is pushed upwards, and that is called as eventration. Then most important, one more point you have to remember is a diaphragmatic hernia. So diaphragmatic hernia, as you know, the diaphragm is a muscle. So muscle, this is pierced by the so many larger and smaller structure, and that pierced point is the weakest part. So there can maybe we have the herniation. So that hernia we call diaphragmatic hernia. That may be the congenital. If it is behind the sternum, retrosternal hernia, posterior lateral hernia, we are going to have this. So you have to remember what is hernia, you know. Hernia is the, anyone can tell me the hernia definition? Anyone unmute and tell me what is the hernia?
Abnormal protrusion of the abdominal content through the weakest point.
Who is speaking?
Shreya, sir.
Shreya, na? Shreya Chaugle.
Yes, sir.
Okay, correct. Your definition is right one. So whatever Shreya told just now definition of the hernia is correct. It is an abnormal protrusion of the abdominal contents through the weakest part. It is either anterior abdominal wall or from the diaphragm or posterior abdominal wall. So that is you have to remember. So here we have the congenital hernia. Those names are here given. That is not much important. You should remember the diaphragmatic hernia. And what is hernia you have to remember. And what is a congenital or acquired hernia. You have the acquired hernia. You have the acquired even posterior hernia. So in the acquired hernia, you have to have the hiatal herniation. Hiatal is one which is elevated, one which is dome making part that we call as a hiatal hernia. Maybe congenital or acquired, which is a hiatal hernia where the esophagus is entering, crossing the diaphragm. Through that, it is protruded. Then we have that is a hiatal hernia. It may be also the congenital or acquired. So whatever this is, almost all, that is a posterior mediastinum in front of the cardiac end of stomach appearing herniation, that we call as an hiatal hernia. And this hiatal hernia is commonly relates to the, that is the, in the, that is to the diaphragm, and even acquired hernia. So almost all the summary of the diaphragm, diaphragmatic hernia, you can remember, classify as a one which is you should remember congenital, acquired. Congenital I have told retrosternal, posterolateral, posterior and central. Acquired means what? When trauma occurs, there is a damage to the phrenic nerve or trauma to the diaphragm, abdominal hit or the trauma that we have. And hiatal, we have the congenital or acquired. So that is a very important point which is you have to remember. So this is all about the diaphragm. Only 3 minutes are remaining. Anytime you can close. So that so this is what about the diaphragm. So common questions in the thorax, if it is asked about the thoracic diaphragm. Explain thoracic diaphragm, or what are, if it is asked for the even question separately, what are the larger and smaller openings in the diaphragm, that you have to remember. And whatever the one diagram you have to practice is this one. Almost all the you have to practice this diagram, only more than sufficient. So, and these three openings, larger openings, you have to remember. So, Sripad Gangul, are you understood the diaphragm?
Yes, sir.
Okay. Any doubts in this? Any doubts in this?
No, sir.
No, na? Okay. Are you understood all points? So next question, which is topic sent to me, is that is about the pharynx. So Saturday I am going to cover the pharynx. So that was also given by one of the student. So I am covering. So if you send the topic revision and what is the weightage and important, according to that I choose, and I can almost all the topic and syllabus are covered. and according to the question pattern, according to the skeleton, according to the weightage, all are covered topic. And you have to remember about the only the few topics which are you want, that is a revision, I can take, but don't go which is you should understand the weightage of the all, and you can study. Don't waste your time in studying the that is unimportant also sometime. Okay, so when I have told the skeleton and all, that time I have told you the what is the importance of that CNS and all, but CNS I have covered. So any other are there, you can send it to me topics and I will plan out. So anytime we can close it, so that almost all this is about the today's topic. Next Saturday, coming Saturday, I am going to take you, that is the pharynx. Okay, so this is all about today's. Have a good day and study hard. Your date of examination is declared, and that is 24th November. So now you have the time of exam. So study hard, complete everything. So this is all about the today's my lecture.